Hi, my name is Amanda, physician assistant over at Care Pediatrics. I wanted to take a second to answer a question that I get asked in the clinic all the time. Parents will bring their kids in, pulling at the ears, wanting to know, is it an ear infection or is it just teething pain? And it's a good question. I'm gonna go through a couple different symptoms that can help you tell the difference. First, a couple signs of ear infections. If they're pulling on their ears and they have a fever, they likely have an ear infection. If they're really irritable at night, they're just not sleeping as well as they normally do, they might have an ear infection. A pretty telltale sign of an ear infection, if there's thick yellow drainage coming out of that ear, not just wax, but a thick yellow discharge coming out of that ear, that's probably an ear infection and should be seen in the clinic. And some signs of teething pain are gonna be chewing on everything they can get their hands on. You'll see drooling, and you'll look in their mouth and they'll have a little bit of swollen gums in there, especially where you would expect a tooth to pop out. There might be some whiteness there as well as the tooth is trying to erupt through those gums. Another sign is just the fussiness comes and goes. They're not irritable all the time, but it comes and goes as that tooth is inching its way up. One of the things that confuses parents is that there can be ear pulling with teething pain because the pain from those gums can radiate up to the ears and they can just go to town on those ears even though it's just teething pain. Another thing that confuses parents is typically a 4-month-old has an oral fixation where they are putting everything in their mouth, they're drooling all the time, chewing on everything. Right around 4 months of age is when they learn that, but they likely are not teething at that point. We typically don't see teething until after 6 months of age. That's another common one that tricks up parents. If you're ever unsure and you're not sure if it's teething or an ear infection, feel free to bring them in. We'll be able to check your kid's health and make sure that they're comfortable. Your little one's health is our #1 priority. I tell parents all the time, I would much rather you come in and let me reassure you than for you to wait and have something bad happen. So I love a reassurance visit. It makes me happy to be able to assure parents that their baby is okay and that they are just having a little bit of teething pain.